Dr. Zhitnitsky, I would like to kind of have you talking a little bit about orthodontic treatment, braces treatment, perhaps Invisalign, which I think is, a very new and wonderful, not so new, but nevertheless new and wonderful way of straightening out teeth. And I really also wanted to shed some light on how adults using braces for cosmetic dentistry instead of, shaving down their teeth and grinding them down and then putting veneer on it and lumineers, as you mentioned, that sometimes a couple, 2, 3 teeth in front really can be wonderfully fixed with this new thing called Invisalign.
Oh, you're absolutely right, Helmut. The problem with braces is people are really apprehensive, especially when they're grown-ups, to have a bunch of wires and metal in their mouth. It makes them feel that they're immature. Invisalign, or any kind of company that does invisible braces, they're completely invisible. People won't even know that you're wearing them, and yet they do the same job as traditional braces in a lot of cases.
So they really are invisible, huh?
Practically invisible. A lot of people that wear them and nobody would even know.
Beautiful. And tell us how it works.
It's very simple. We take impressions, we make study models, we make molds of patients' teeth, and we measure everything, and we see what kind of movement we need to do in places, and we send it off to the lab, and they get those little clear retainers that they have to wear, and they have to switch one after another approximately every 2 to 3 weeks. And every retainer moves your teeth just a little bit, and then the next one moves it just a little bit, and the next one until you get the desired result.
Interesting. So does the patient get all the retainers and then he just does it himself and he's on his own, or does he get 1 or 2 of them and then he keeps coming into you every so often?
Yes, absolutely. They have to come and see us so we can make sure that everything is going on track and there's no problems. And if there are problems, so we can fix them without them going any further. And the appointments are really simple and short, and we've never had anybody have a problem coming in.
Yeah. What about if a person loses or breaks such a retainer?
Oh, no problem. Since everything is computerized, we could have a replacement done in a few days.
Got it. Okay, now tell me. Apparently those Invisalign things have been made, and as you kind of mentioned, adults really like it. Because they don't like saying. What about the everyday teenager who might even like his braces with a little, like a flag on it or something like that, in front. Anyway, can teenagers also use it, the Invisalign?
Some cases, yes, they can. It all depends on how far their jaw has grown. If their jaws are completely grown and they have adult jaws, they absolutely can use Invisalign. And if not, then we can fit them for regular braces.
Mm-hmm. What about discipline? Because I heard that's why Invisalign started more like for adults, because they're disciplined to, because after all, this retainer comes out for eating. So it comes out about 2, 3 to 5 times a day whenever you eat. And children have a little more hard time to know where they put it and put it back in.
Yes, you have to wear it approximately 22 hours a day, and the rest of the time is when you eat. So obviously we talk to the patient and we explain everything, and if it's a perfectly mature young adult, there shouldn't be any problem.
There shouldn't be any problem. And because a big advantage apparently with the Invisalign is not only that it is invisible, which of course I think it would be fantastic, but I never wore braces, so but yeah, I think it would be great, is the fact that when you wear braces, it's very difficult to brush your teeth, and sometimes below the wire or below those little metal little square things, all of a sudden you have stains. So also it looks like sometimes when you take off braces, and if the patient who wore braces for usually 1.5 to 2 years isn't extremely dedicated in brushing and flossing in a very complicated way, kind of, he might have now straight teeth, but he now has gum disease. Is that true?
Yes, it's very, very important. That's why whenever we have a patient that wears conventional braces, we stress brushing and flossing and using electric toothbrush and floss threaders. There is a lot of stuff that's involved. When you wear invisible braces like Invisalign, you take them off, you brush your teeth, you put them back on. It's much easier to maintain.
Right. And so the danger of perhaps, if you don't maintain it well, creating gum disease, which you have mentioned in other videos, is devastating, really devastating,
Yes.
is greatly diminished, if not gone.
Right. Gum disease and decalcifications, that little white spots that you see on people's teeth, that's also very minimized, if not eliminated completely.
Right.
And in fact, if you straighten somebody's teeth that were really crooked, that leaves more room for their gums to be in normal shape, and it actually helps with gum disease.
Well,
having straight teeth.
The straight teeth in itself helps with gum disease.
Yes.
Right. Well, the braces would do that, of course, also. It's just, with the braces, they keep the spinach there hanging from a flagpole, and here it doesn't. So what about the guy or the girl who is a little more self-conscious and doesn't quite trust that these things are not totally invisible, and he or she has that all-important date or job interview? If he every so often takes it off for an hour or two, no real big harm done, right?
Oh, absolutely. If it's just that, it's absolutely fine. The problem comes when the patient stops wearing them altogether. That way they will not work. It's very important to have somebody who's understanding that they have to wear it. But if you have a very important meeting or a date, a dinner, you can absolutely leave them in your pocket and put them in later.
All right. Well, Dr. Zhitnitsky, you shed some light on those braces things. It's very important data, very nice data. Bye-bye.
Thank you.